conditions like your measles, mumps, rubella, right? Your varicella. So next, in sickle sequestration, yes, we can give aspirin and acetaminophen. So aspirin, it can help, it can somehow help with the blood clots. So in order for the RBCs, the sick RBCs to not clump together, we can give them aspirin. And also with your acetaminophen, again, because they are at risk for infection, we can give them antipyretics like your acetaminophen. So in sickle cell sequestration crisis, which of the following interventions is indicated? Number 1, administer large amount of oral or IV fluids, yes or no? Is a yes, to keep the blood from flowing, to keep the blood flowing from one area to another. Number 2, administer analgesics, is a yes. Prepare for blood transfusion, yes, especially your PAC RBCs. Number 4, administer oxygen. Yes. Number 5, encourage ambulation. Question, if your patient is in a sickle cell sequestration crisis, will there be a problem with their oxygenation? Yes or no? Yes, because remember, sickle cells doesn't have oxygen in them, so there would be a decreased oxygen in their body. If there is a decreased oxygen in the body, do we promote ambulation? No. Okay, we do not promote ambulation because that would mean that they need to use oxygen, of course. Number 6, use hypothermia blanket. Do we decrease actually the temperature of your patient? No, that could cause more blood clots in the body, right? Cool extremities. Next, let's summarize here. Certain conditions wherein there would be prioritization of your interventions. For example, your airway obstruction, of course, positioning. You would want to put them on a high Fowler's position. Could be your tripod position also. If there is swelling on the airway, you might want to do your tracheostomy and give epinephrine, for example, that your patient has allergic reaction or anaphylactic reaction. For near drowning, you keep them warm because hypothermia can happen in their body due to the coolness of the environment. For bee stings, you scrape the stinger, okay? Because as long as the stinger is there, it can still cause swelling in the area. So we remove the stinger immediately. For jellyfish sting, we can apply shaving cream and rinse with vinegar. Guys, do not pee on the person who encounters jellyfish sting. It will not help. If what do you call this? If you do not have the shaving cream, just rinse it with vinegar. Vinegar is very much available almost everywhere. For tick bites, you remove the tick with tweezers. For snake bite, you immobilize the extremity. No need for you to put a tourniquet. Just make sure that make sure that the level of the extremity is lower than the heart. Next, for cardiac arrest, of course, we can administer your epinephrine and of course do your CPR. For pediatric triage assessment, it includes appearance or work of breathing and circulation of the child. You assess your ABCDE, your airway, breathing, circulation, any disabilities or exposure or environmental control. Next, we do our history as to why our patient is suffering from such complication or what happened prior to them going to the hospital. You assess for vital signs after, if there is fever, and you also include in your assessment pain, because like they said, pain is also a concern, is your 5th vital sign or 6th vital sign. Now remember that parents are the best judges of their infants because they are the ones who live with them. They are the ones if the activity level of the child is normal. Okay, us, we only handle them for several minutes, several seconds, several hours, but for them, they live all throughout 24/7. When assessing an infant for perfusion and respiratory effort, the infant must be unwrapped and undressed so that we are able to know if there are any retractions on the lower chest and on the xiphoid process. We are also able to see whether they are now breathing abdominally again, which could be a sign of your respiratory distress. When assessing an infant, the triage nurse must pay close attention to the history offered by the parents or the caregiver that was with them, as this may be the only real clue to the problem. Okay, usually it's not just the parents, it's the caregivers. Because, for example, what if the child lives with the grandmother and the grandfather? Of course, we take into account the history of the grandmother and grandfather, because the parents will not will not be able to provide us any information since they are away. It is universally accepted that neonates of less than 28 days of age with rectal temperature of 38 degrees Celsius or greater are considered high risk for serious bacterial infection and should be triaged accordingly, wherein there should be timely treatment also, because this can cause death for your clients, your infection for neonates. For children under age 3 with fever, the American College of Emergency Physicians recommends measuring infants' temperature rectally so that we are able to get the accurate core temperature of your client. For infants with rectal temperature of 38 degrees Celsius or higher, are likely to need a full sepsis workup, including your blood, urine, and CSF culture. We want to cover all the bases as to why our patients who are infants have that type of hyperthermia. Okay, so it could be from your bacterial meningitis. We have to cover that also. We need to do blood culture in order for us to target the microorganisms with a certain antibiotics that would be helpful for them. Oxygen saturation should be measured in infants and children with respiratory complaints or symptoms of respiratory distress. Guys, with infants and children, we do have a pediatric oxygen pulse oximeter. It's smaller than your normal pulse oximeter and is very much accurate with the reading of your infant's oxygen saturation. Have you seen that? Have you seen your pediatric pulse oximeter? It's just slightly smaller, but it fits snugly on the fingertips of your patients who are pedia. Compared with your adult type, your normal type of pulse ox, there's a lot of risk factors that could cause for a false reading for your pediatric client's oxygen saturation, like movement. Now, altitude sickness causes hypoxia and polycythemia. Altitude sickness is when for example, the height or the altitude changes too rapidly that the body cannot adjust. Okay, there could be a reduced oxygen and changes in air pressure inside the body and can cause your hypobaric hypoxia. Okay, wherein there would be the oxygen or tissues in the body lacks oxygen already. So in severe cases, your altitude sickness can cause fluid buildup in the lungs or the brain or even both. So it can cause your hypoxia and polycythemia. Your Diamox or your acetazolamide is a drug of choice for prevention of mild altitude-related illness that could be given to your patients with vertigo also, epilepsy. It serves as a diuretic and also an anti-glaucoma medication. The immediate emergency care for a near-drowning victim should focus on a safe rescue of the victim. So do not send anyone, or if you yourself cannot swim, please do not try to rescue the victim, because in the end, there could be two victims at the site. Okay, so for example, if you cannot swim, you can, what do you call this? if the patient is too far away from shore, you might want to the rescuer might want to be on a boat to rescue them, because of course it would be difficult for them to go to the patient and go back to the shore with the patient. The client who has nearly drowned is at risk for pulmonary infection because the waters for sure has microorganisms in them, acute respiratory distress syndrome for sure, and CNS impairment. Okay, let's go back with your heat stroke. Again, your heat stroke is a medical emergency and can cause death to your patient. An exertional heat stroke is different from your classic heat stroke. When you say exertional heat stroke, it's a sudden experience for your patient. For example, the temperature outside is 40 degrees Celsius. You came from inside your house, which is, let's say, which has an air conditioned unit, so it's very cold. So when you go outside in the 40 degrees Celsius, the body might feel so hot because of the 40 degrees going from a cool place. A classic heat occurs over time. For example, construction workers, farmers, they are at risk for classic heat stroke because they are in the area for long periods of time. It builds up. For heat stroke, it could be characterized by your ABCs, your agitation, bizarre behavior, coma or coordination loss, and even your seizures and hallucinations because the brain is also somehow fried. The vital signs in heat stroke includes your hypotachy-tachy, hypotension, tachycardia, and tachypnea. Now, which of the following helps prevent heat-related illness? Select all that apply. Number 1, avoid overexposure to the sun, yes or no? Is of course yes. If you find a shade, might as well go to the shade than expose yourself to the heat. Number 2, increase fluid intake before, during, and after exercise. Is a yes. Okay, hydration is a must in order for us to prevent heat stroke. Number 3, wear lightweight, light-colored, and loose-fitting clothing or non-constrictive clothing is also a yes. And lastly, use SPF 30 sunscreen. Yes, and question, do you reapply or should you reapply sunscreen every now and then? Yes. Okay, so it's not just a one-time thing. You have to reapply it over and over again. Next, which of the following intervention is appropriate for the management of heat stroke in the hospital? Number 1, do not administer aspirin or antipyretics. Again, that's a yes. Number 2, administer 0.9% NSS. Is a yes, hydration through the vein. Number 3, administer oxygen by mask or nasal cannula. Do we give oxygen for patients who encounter heat stroke? Yes. Number 4, administer muscle relaxants for shivering. Is also a yes, because when they shiver, it would also cause, it would somehow cause an increase in their temperature. You're providing warmth to yourself. Okay, so it could cause a further increase of your temperature. Number 5, monitor rectal temperatures. Would we rather have the core temperature for patient to have heat stroke? Yes, because that's the most accurate one. Number 6, low cooling interventions when the body temperature is 38.8 degrees or more. Is yes. Okay, we have to let the body adjust somehow gradually. Next, which of the following interventions are appropriate at the scene of a heat stroke? Select all that apply. Number 1, ensure a patent airway. Yes or no? Yes, of course, because your patient would most likely need to breathe. Number 2, bring the client to an air-conditioned room. Is yes, somehow make it cooler for them, because if you put them still outside, it could still increase their temperature. Number 3, remove the client's clothing. Yes, especially if it's constrictive. Number 4, pour or spray water on the client's body or scalp. Is a yes, especially on the scalp, guys, so that somehow the brain or the head will cool down first. Number 5, place ice pack on the scalp, groin, under the neck or armpits. Is a yes, okay, because with your groin, under the neck or armpits, that's where the heat is concentrated. So we put ice packs on them. Now, hypothermia is a core body temperature less than 95 degrees Celsius wherein the body will become cold. So there are different categories when it comes to your hypothermia. You have your mild, moderate, and severe. For mild hypothermia, it's between 32 to 35 degrees Celsius, moderate 28 to 32 degrees Celsius, and for severe, less than 28. And that would mean that your patient will have less oxygen going towards their organs. The priority in hypothermia is a core rewarming. So we can usually put them in warm bath. That's okay. We can give them warm saline. Now, ventricular fibrillation can result from moderate to severe hypothermia. Although sometimes your ventricular fibrillation could be from unknown causes, but there would be with your ventricular fibrillation, there would be a disruption of your electrical signals in the heart that can cause the disordered heart rhythms. Now, the usual cause of your VFib would be lack of blood going to the heart. And with your hypothermic state, since there would be poor blood circulation, the blood will not also be able to get blood. So there could be ventricular fibrillation. Now, a client with hypothermia is best kept in a horizontal position. So in water accidents, it is best for you to put them on what we call this, on a horizontal position, supine position, and make sure what we call this, and make sure you maintain that position until you go to the hospital. Okay, so that we can decrease the likelihood of your rescue prolapse. When you say rescue prolapse, that's the cardiac arrest that occurs during extrication of the patient from the water or transport to the hospital of a severely hypothermic client. Now, the management of your snake bite depends on the severity of envenomation. When you say envenomation, it is the exposure of a person to a poison, or toxin from a bite or sting of an animal. For example, your snakes, your scorpions, your spiders, insects. So do not confuse your venom, your what you call this, venomous with poisonous. When you say venomous, the animal bit you. It means that they are venomous. When you say poisonous, you bit them. Okay, you bit them and you were poisoned by their, let's say, their meat. Okay. Now, newly dead or decapitated snake has an active bite reflex that can inflict bite for 20 to 60 minutes because what do you call this? They have what do you call this? Their metabolism are slower than us as humans, so their internal organs can stay alive for longer. That when they inflict a bite, they can still give venom. Now, snake bites can lead to your DIC, and your DIC stands for your disseminated intravascular coagulation. Chinatown Adventures. What? Is there snake? What is Chinatown Adventures? Is there snake eating there? Snake soup? Okay, so again, your DIC, disseminated intravascular coagulation, it's a rare but very much serious disorder wherein there would be abnormal blood clotting throughout the body's blood vessels. Okay, so what do you call this? There would be formation of blood clot, but there would also be bleeding. How come that happens? Because the body has used already all the platelets to form the blood clots, and now afterwards, after some time, there would be no platelets anymore to use to clot the blood. Now there would be bleeding. Okay, because the blood clots has already used up the platelets. Okay, snake blood, why? Okay, the first priority in first aid treatment of snake bite is to move the person to a safe area away from the snake because there is a likelihood that the snake will bite the person again. If they feel as though, for example, you went to the site and you wanted to extricate the person from that area